So welcome again, everyone. My name is Jamie Demore, and I am the Executive Director of the Canadian Primary Care Research Network, or CPCRN. And we also have a small and mighty panel today. O'Neill Bhattacharya also is participating on this panel for this session. He is the nominated principal investigator of the CIHR grant that is supporting this work. And he is also the chair of the Center of Digital Health Evaluation. And he's the director rather, and then the chair also at the Women's College Hospital. And so it's nice to have you here. Thanks, O'Neill. And Brenda Andreas unfortunately could not make it today, so we'll just move along here. So just in terms of the session itself, it will be 30 minutes of content. Sorry, we're a little bit late today. And we'll have about 30 minutes of question and answer section. Please type in all of your questions for the panel in the question and answer section of the webinar, and leave the chat section for other comments and other certain questions regarding the series maybe, and leaving your land acknowledgements as well. So moving along, here is the agenda of the learning series number 1. So I would like to begin, I'm going to stop share momentarily with a land acknowledgement. I myself work and live in Montreal, so my land acknowledgement will have that focus. So we encourage you to type in your particular land acknowledgements in the chat. I acknowledge that the place in which I work and live is situated within the traditional unceded lands of the Kanien'kehá:ka peoples. There is also a strong historic presence of Anishinaabe peoples in what is now known as the Greater Montreal area. Teokotiaka, or Montreal, has also been and continues to be a gathering place for many peoples from all directions. We honor and thank the traditional custodians of this land and strive to work for the success of future generations. So now go back to sharing. So again, here is our agenda. We're going to go through the objectives of the session, and it's essentially an overview of our network. Some of our principles and values will be covered, our objectives, our research and governance structure, our investments, and what some of the impacts and value added that we would like to achieve. And again, as I mentioned, there will be a 30-minute question and answer section at the end. I'm stuck there for a second there. My apologies. So here are the learning objectives of this session. We hope that you will learn more about the CPCRN. We hope that you will learn more about the CPCRN's objectives, activities, and investments. We hope that you will have an opportunity to ask questions about the CPCRN. And we would like to potentially discuss, if we have time, how the CPCRN can engage differently with its various diverse partners. So in 2021, we engaged with a consultant and we essentially co-built a lot of different elements of the future work of this Canadian Primary Care Research Network. We co-developed principles and values. We co-developed a new governance structure. We co-developed which areas of research we would like to focus on. And there was a strong consensus that was reached through this network-wide activity. And so we would like to kind of cover some of the principles and values that came out of this process. We really want members we want to be as inclusive as possible. include all of our partner groups, patients, clinicians, policymakers, scientists in the decision-making process. We want to continue to collaborate. Stuck here. We want to prioritize research for which matching funds are available and does not duplicate our SCORE efforts. We want to, sorry, I'm stuck here for some reason. We want to establish a research agenda that reflects the priorities of multiple province territories and encourages cross-jurisdictional collaboration. We want to foster equity, and this is a really important principle for us. We are committed to supporting equity and facilitate the distribution of research funds across the country equitably. We want to ensure that our decisions and decision-making processes are clearly and consistently communicated. And we also want to be fiscally responsible with all of our budgetary decision-making, ensuring that it reflects responsibility as it relates to fundraising. We also want to build a network that's sustainable. Even beyond the work of the 5 years of this grant from CIHR, we want to build a network that's sustainable. In terms of values, we want to ensure that all of our activities and working committee meetings, essentially members demonstrate respect and openness for others' perspectives, needs, and capabilities. We want to build trust across the network as well. Members act in trustworthy ways and trust others' motivation and commitment to building a pan-Canadian primary care research network. Members engage in honest, open, timely, and constructive communication with one another. And we want our members to demonstrate empathy towards others in the groups and that we are slow to judge. We want to create all of our spaces that for our meetings where it's an open space where no one is judging each other. And then these are our 7 objectives that we would like to achieve over the next 5 years. In the center, the bottom purple section demonstrates how we want to create a learning health system in primary care. We hope to do this in 2 major ways. We would like to build a primary healthcare information system across Canada, but also so that's the technical piece. And then the human resource piece, we would like to continue to nurture and build our practice-based research and learning networks across Canada. The primary healthcare information system, or the learning health system rather, is really the idea that we take data, we generate knowledge, we do research, we generate knowledge, we apply that back to practice. Practice then generates new data, and then it's a cycle in the center of that diagram. And that's really the idea of what we would like to accomplish in primary care research. So in order to build a primary healthcare information system, this will build on some of the work that's already been done with the Canadian Primary Care Sentinel Surveillance Network. And will also be, and this essentially is the network that they're already working in obtaining EMR data from primary care practices. And we hope to grow this, of course, across the country. And from the human resource side perspective, well, we hope to build or nurture our practice-based research and learning networks so that they're able to, for example, recruit more family or primary care practices in order to get more EMR data. And we also hope that in terms of the primary care information system itself, it will be EMR data that's linked to PREM and PROM data, or patient-reported experience and outcome measures. And this will also be linkable to administrative data as well. We hope to collaborate with the organization Canadian Primary Care Information Network for some of this PREM-PROM work, and also collaborate with the HDRN as well in terms of this very complicated ambitious objective. So just to kind of move along, because we have a lot to cover, we also have 7 research projects that we funded in the grant. And I'll get to a little bit more about those different research projects in the next slide. The idea here is to really scale and spread our successful patient-oriented research and innovations across the country. We will, as a network, we are building upon our successes as well of the PICI network, and we'll continue to strive to generate and mobilize knowledge that informs and transforms practice. So knowledge translation and exchange. We hope to continue to increase capacity among researchers, clinicians, policymakers, and all of our partners. We hope to continue to nurture a highly coordinated, decentralized network in terms of governance and operations. We hope to create and nurture sustained partnerships with diverse partners. And this is really an important objective for us. It's something that we really think is important work for our network. We think it's important to engage with partners in all of our different activities. And we hope to evaluate our engagement better to understand what processes are successful for us in engagement and creating sustained partnerships. So that one is truly important for a network like ours. And then lastly, we have a new area where in the past we haven't really focused on is equity, diversity, and inclusion. And this time around, we would like to enrich and support opportunities for people and people of color to become career researchers in primary care. In terms of our research projects, I mentioned that we would kind of delve into those. I mentioned the consultants that we had in 2021. So some of our research pillars that we came up with, one was access to care is really important to us in terms of, and we have 2 projects that we are funding, one regarding advanced access and one regarding virtual care. We also have the second research pillar is integration of care. We have a few projects listed there as well, one in case management, one in chronic kidney disease management prevention in primary care, one in addressing social determinants of health in primary care, and some research building infrastructure using data in primary care research. We also have a focus. 2 of our research projects are focused on building the infrastructure of our primary care information system. One, for example, is developing a survey to collect patient-reported experience and outcome measures. So the OECD Paris project, which many of you are probably familiar with, and an organization I mentioned before, Canadian Primary Care Information Network, will also be assisting us with collecting data in the Prem and Prom space. We also have a research project focused on decreasing inappropriate antibiotic use as well, to help build the infrastructure of this primary care information system. Our third research pillar is in Indigenous health. And this particular pillar, we are still in development. We have a committee that's dedicated to this, and they will begin soon in developing research priorities and then a future research project that we have earmarked funds for. So here is the governance structure of the CPCRN. In the purple quadrant, you have the oversight and operations, the steering committee, the executive committee, and a management team, which really consists of all of the network staff and network managers across the country, including the executive director. We have in the yellow quadrant working committees focused on communication and knowledge mobilization, research and implementation science, primary care information, building capacity. And we also have a committee focused on evaluation. So really focusing on how can we evaluate our successes of the network. In the reddish orange quadrant, we have our practice-based research and learning networks across the country. And then in the green quadrant, we have our research projects or pillars. And then along the bottom, we have our primary care information system, which really consists of those two, EMR data and Prem and Prom data. So some of the benefits that we hope to achieve, we're in the process of recruiting into our online community of practice so that we can more readily communicate with all of our diverse partners. We hope to, of course, as mentioned, create a primary care information system, and we hope to have a better access to all of our partners across the country through our various mechanisms of engagement. And currently, there is no FPT table for primary care counterparts across the country in terms of policymakers. So this is something that we also hope to develop in this iteration of the network. So in terms of our financial investments, we received $10 million from CIHR. And we also had to raise $10 million in a very short time period in matching funds. Most of this money, we were very successful in doing this because of our practice-based research and learning networks were able to raise funds very quickly. Most of the matching funds were provincial money, and they had to remain in their various jurisdictions. The majority of this is just concerning the $10 million investment itself. So we funded, we have 8 research projects, including the Indigenous Health project that we earmarked. They're funded at about $75,000 per year for 4 years. We're going to fund CPCRN, as mentioned before, to support the EMR data set work, and CPIN for the Prem-POM data. And then also our various practice-based research and learning networks across the country, our 11 provinces and territories, funded about $50,000 per year over 5 years. We have a distributed support model in terms of human resources. So the executive director and senior administrative coordinator are full-time salaries at UBC and BC. We have 4 part-time FTE positions across the country, 1 in Nova Scotia, 1 in Quebec, 1 in Manitoba, and 1 in Ontario. And these were funded for work and engagement, communications and knowledge translation, research, and primary care information system work. We also put aside a good amount of money for patient partner compensation per year and knowledge translation exchange initiatives and building capacity. We are committed to supporting the Tutor PhD program per year, which is a training program in building capacity in primary healthcare. We have other network expenses such as translation and a lot of different things, meetings and conferences, etc. So as a network, we hope to have many impacts. We believe our network structure ensures collaboration and innovation. We believe the network structure supports research and possibilities for raising research project funding very rapidly. We've been very successful in the past in this arena. And we believe our network provides opportunities to strategize, share, and learn from each other with all our various working committees. And then we also, as mentioned, plan to create a community of practice for our network of all of our diverse partners being able to communicate well to each other, connect, email each other, have vibrant conversations. So this platform is very akin to NAPCREG Connect, if you're familiar with this. And it's essentially a space where people can post inquiries or certain questions. And then it's a space where vibrant conversations can occur, and then people can connect with each other as well. So that's it for me. O'Neill, did you have anything to add to anything?
Sure. Yeah. First off, thank you all for joining us. Just to build a little bit on what Jamie has described in terms of our activities, we, received funding from CIHR. We have allocated a bunch of funding, but we fundamentally think of the Canadian Primary Care Research Network as a platform upon which to build, a base of information on primary care. And so there actually is a lot of potential going forward. There are multiple people who are putting in team grants and so forth that could leverage the infrastructure that we have. And that, thinking about current opportunities when we look at the Canada Health Transfer, which will have a strong focus on primary care, particularly the area of attachment and access for unattached patients. I think all of you could think about this as an opportunity to build on. One of the reasons we set up this network is that the scale of primary care research historically has been really relatively small, and it's hard to make an impact on systems and policies. But that the shift now to something that operates not only on a larger scale, while working across provinces, but actually includes every province and territory, gives us access to, Health Canada in a way that maybe we didn't have before, the OECD Paris being an example of that. But also the opportunity for facilitating shared learning around a wide range of topics. We've mentioned virtual care. I think how we manage unattached patients going forward, how funds are allocated from the health transfers is another area. So just to say that, I want to open this conversation up to not just delivering on what we've planned to do with CIHR, but what are the possibilities for the future and opening up to the broader primary care community.
Thanks, O'Neill. I'm trying to see if there's any.
There was a question on that acronyms. So maybe, Mara, if you don't mind, we could put a little bit of a glossary into the chat. CPCRN'S. I think we mentioned there was a few others.
Yeah.
Proms, a few other things.
Okay. Yeah, I always defined them, but maybe I went quickly. Yeah, PREM and PROMs, patient-reported experience and outcome measures, CPCRN, Canadian Primary Care Research Network, CPCN, Canadian Primary Care Sentinel Surveillance Network, Canadian Primary Care Information Network, CPCN. So yeah, maybe a glossary could be helpful for sure. Anybody have any other questions? Because I don't see any.
Yeah, there's one from Jody. There's one from Jody here on what will be the first step for getting more involved. So I think maybe Jamie, you can elaborate on this, but essentially there's a bunch of activities that, where we're recruiting, we're interested in people helping on projects, on committees, on, connecting to ongoing work. And then the broader opportunity, probably relates to, getting involved in future work. But I think there's a lot of activity. And so Jody, maybe you can reach out to Mara or Jamie. We can learn a little bit more about your interests and then see how we can connect you to ongoing activities. Jamie, can you see the chat or not?
Yeah, now I see it. I thought, I was trying to get more people to, maybe they couldn't enter questions into the Q&A section. So I was looking there. So okay. So so what would be the first step to be involved? I would say there's a few ways. You can take a look at our website. And I don't think I have, maybe Mara can put the website into the chat for you. I think you could also check out and join, there's an area that you could join our newsletter on the website. And so you could sign up for that. And then you could also join our community of practice if interested as well. There's an area but you have to join a platform called Timed Right. And in there you could then be part of the vibrant conversations that we eventually hope to have there. So those I think are the immediate. And if you wanted to reach out to me, I'll put my email in the chat. If it's regarding potential research projects that you might want to be involved in, or in any other way, please feel free to reach out.
And we'll put in a good word for Brenda, which Brenda Andreas, who's the chair of our patient committee, who's been involved with us since day one, writing the grant, managing the executive, setting up the patient advisory committee, and that she's a real powerhouse. And it's unfortunate she wasn't able to join us today, but thank you, Vivian, for highlighting that. I think patient partnership is a core element of SPORE as the strategy for patient-oriented research, as I'm sure you well know. And so, that's something that we've had patient partners from the beginning, but their role has expanded over time. And Brenda is in the process of, recruiting a broad group to participate.
Yes, that's correct. And they're in the process of, they're going to also have an in-person meeting attached to Casper in Montreal. And they really hope to really co-develop their future work for the network, and to really kind of evolve from consultants and be more involved in all of our activities. Yes, I would like to stress that patient partners are actually involved in all of our network activities across the network and the country. So that's it. You also noticed in the center of the governance structure, the patient council is in the center, along with the indigenous committee. Those two are really important to all of our activities of the network. And we're also in the process of co-developing a policymaker hub or a committee that will consist of policymakers interested in primary healthcare research. So they were also in that structure as well. So again, engagement with all of our partners is a crucial part of the work that we do within our network. So I see a question here: where can we find more info on the current research projects? I would like to actually work with our communications team in order to develop a page on our website in order to delve in more about our research projects. A lot of our research projects have their own websites, so we'll gather some of this information but I also have an extra slide here of our research projects too. We can agree to sharing these slides with you if you are open to that.
Jamie,
but this is something that's on my list.
Oh, sorry.
Go ahead.
I was going to take Tarek's question about the priorities. So Tarek, you're asking about whether the research priorities set are as presented, or can they evolve? So I think yes, they could evolve. Now I have to say, access to care, integration of care, information systems, and Indigenous health are relatively broad categories. And I think we'd be open maybe to modifying, but I think there's a lot of things that will fit in within that. I can see the next 5 years of the Canadian health transfers will probably galvanize cross-provincial efforts and create an interest in the federal activities that span provinces that we haven't necessarily had historically, but that there will probably be quite a bit of future work on access, and maybe thinking about attached and unattached patients, and how do we grow attachment, how do we expand the health primary care workforce, and thinking about team-based care and so forth. So those are, I think we may be able to expand whatever is included within the existing pillars, and at some point probably the policymaker committee may think about a process where we define new priorities in the future. In the first wave of PICI, we actually spent time with all the policy leads defining a subset of priorities that were shared across every province and territory, and finalized that at a meeting in Washington, maybe about 7 years ago. And so there was kind of one round of that. This round didn't involve that type of process, but Jamie, I think that's something we can consider in a couple of years in, a process where we look at the priorities of every province, figure out what is the subset of shared priorities, and then use that going forward. So Tarek, the answer is probably we're going to carry on with the ones we have now and then maybe shift with guidance from our policy leads.
Yes, we also, as mentioned, have a research committee, and I think they will be responsible for putting forth a mechanism for how future research projects will be added to the CPCRN umbrella. And this will most certainly include some sort of a review from patient partners, from the patient council, in order to assess the patient orientedness of the research. But also the research committee will also be focused on a mechanism, again, for developing future research priorities. So I think they're not set in stone. They can probably evolve, and we need to create those processes and ways to engage with, because this is really going to be a network wide activity as well. So I think Jen Lawson, yes, I see, also has a question in here regarding, so there technically isn't a social determinants of health pillar. We have a research project that focuses on Andrew Pinto's SPARK project is going to be kind of delving into social determinants of health in primary care. O'Neill, did you want to elaborate on her question a bit? Because she's asking, she wants us to elaborate on that research project. I'm not exactly sure how they intend to do this. I'm not sure if you are familiar with this off the top of your head.
Sure. So the SPARK project started, there's an example of a project that went through all the phases of funding. So in the primary integrated healthcare innovation network, it was a quick strike project, launched probably 7 years ago at the sort of the beginning of that previous iteration of this network. It went on to get to be a programmatic project, so got about $1 million from CIHR to expand, but the core of it really was collecting information on social determinants in primary care as part of routine services. So identifying things like income and food insecurity and different things through standard surveys that were done in primary care in the waiting room and then included in the electronic medical record, and then developing a range of interventions, both for individuals, counseling them on programs that they might qualify for, and also expanding now more at the community level. And there's a quote, there's a link here from Joseph. Thank you for that. The upstream lab can describe that in more detail. But just to say, what's interesting about the project is both its focus on poverty as a determinant of health, and it's the application of this into routine services. So really links kind of a researchy question to clinical practice and quality improvement. And so it's emblematic of the type of work we want to do. But we don't have a specific pillar on social determinants, though it's a thread in many of the projects.
Yeah, so this is an extra slide that I added into the presentation. I didn't think that it was a bit busy, but as you can see, you see the three different pillars of research: access to care, integration of care. You have the PIs, at least the principal investigators in one column, and then delving, we don't have any project for the Indigenous health pillar of research quite yet, and then a few projects underneath the primary care information system foci. So the social determinants of health is Pinto's project addressing the through primary care, and I think O'Neill did a decent job at explaining what that was. But it isn't a full pillar of research, but it will be something I think that we are very interested in continuing to explore. No other questions there. Let's see.
So,
and as I mentioned, we do want to build a website so people can have a better understanding of our research projects, and then also just provide more support for our research projects in the communication arena. So we'll work with them directly for that. So that's coming down the road. I just wanted to highlight that again.
So, coming back to the original question of how to get involved and what the potential is, I think, one thing people on the call can consider is that many people come to us for letters of support, to include in grant applications. But there could also be, projects that think about leveraging the network. Now, there's a delicate balance here in the sense that we have a bunch of projects, and as you can see, there's 8 projects that span multiple provinces, so they're logistically quite complex. But over time, I think we will have a presence in every province and territory that will make it easier to layer on new projects and allow people to tap into this broader network. One of the values of it is to say, oh yes, I'm plan to do project X. I can tap into a network that has representation in every province and territory. There's a group that you could recruit from. One example of that was I believe it's called CanAdapt now, a big Paxlovid study that Andrew Pinto led. And it's a $10 million study on Paxlovid that's recruiting from primary care. And it's very difficult to make the case that you can, you have got a network to recruit that is that large. But through, the CPCRN, it was possible for him to say, yeah, we've got a network that includes X number of PBRLNs that we, could recruit from. So I think that's something that over time, and coming back to Tarek's question about priorities, over time, I think we'll need a process that thinks about, what projects do we take on, where do we, how we strike the balance. But I think our goal actually is to grow the infrastructure such that we have staff in every province and territory, and the projects, would be supported by, but also would support that staff. And so it's, something I think you can consider for any project that cuts across multiple jurisdictions, and even potentially projects that go, across every province and territory in the country.
Yes, so I don't see any other questions here. So there was one question maybe to all of you. Maybe you can type in some ideas in terms of potentially some novel or different ways of engaging with our diverse partners. That was one of the session objectives. So I don't know, I'm looking forward to see if you have some interesting ideas regarding this, because we are a large network that spans across the country, and we're always looking for different ways of engaging with our partners. Or, of course, if you have any other questions regarding the presentation itself of the network, any other aspects of the network, please type away.
Looking at the participant list, I think there's a mix of people who are in our network and, very familiar with this, and a number of names that I'm not as familiar with. Maybe we could, if you don't mind, those of you who are joining from outside the network, who came here to learn about the network, if you want to comment on anything that would make it, that is of interest to you, and that would make it, interesting for you to join further. I think historically, one of the issues with the SPORE initiatives is fundamentally SPORE is about building research as a networked enterprise, which is, a new thing. And I think, it's something we're getting better over time, but it also be, consolidating a network in some ways meant creating stronger connections between the people in the network. And it was a little bit less of a focus on growing the network. So I think for us, we're at a stage where, we're in a mix of consolidating the group we have, but also interested in outreach and expanding that. So any of you who joined, because you wanted to learn more about this and had any thoughts or questions to share around what would make this interesting to you, please, feel free to include that in the chat. But I think the goal is not to create a walled garden where, a subset of researchers can frolic and partners, but rather something that we consolidate a platform that is then able to engage with others and expand its reach.
Yes, the Monica, I see your question here. So she writes, I believe you said the $10 million came from CIHR. Could you please clarify where the money came from? Okay, so that's another acronym for you. Canadian Health Institute, Canadian Institute of Health Research, CIHR, and that's where the grant is from for the 5 years. So another glossary item.
Yeah, and then there's a match though, right? So it's $10 million from CIHR, which is a federal entity, and then $10 million match, which is mostly from a range of provincial governments, but also some university departments and some other project-based funding, but mostly from pretty much all from public sources, but at different levels, either a university or a regional government, hospital, or provincial government.
Yes, and as mentioned in the presentation, most of that money had to stay within their various jurisdictions because they were locally focused. They're concerned about their local work and supporting their practice-based research and learning networks. But yeah, that we were very successful in raising the practice-based research and learning networks were very successful in raising a great amount of money in maybe a 3-month time frame. For the writing of the successful grant that was funded. So
yeah, so for the networked research enterprise, I think one of the benefits, as James just alluded, is that if you're of a certain size, then it's easier to raise funds because you become attractive to people who want to achieve various things. And I think we've tried to include people from different patients, providers, policymakers, researchers, and so those 4 different groups, include them in constructive ways, and then build committees and governance structures, which I think those are the areas where I think to begin, to have collaborative decision-making processes for research, I think is, newer thing to do at this scale. And I think that's something we're getting better at. The administrative component, I think, is still a work in progress. How do we make this easy for people to engage with in the reporting and all that? But the next phase of it for me, I think, will be to figure out how do we expand the reach of this, but then also facilitate the, collecting the learnings, sharing the learnings, and then build from that. I'll just give one brief example from our earlier phase, but, Mylène Breton's work on advanced centralized registries for unattached patients, which was, again, a project that was in a brief project that expanded, was in multiple provinces, informed policymakers, and also had additional provinces join. And now actually, I think will be part of major federal efforts to improve access to primary care. So I think those are the kind of big opportunities we're looking for. And my sense is in the next year or two, there will be other large opportunities that are like that, where many provinces are trying to tackle a problem in ways that are more potentially coordinated, and that we will look to you, who are all folks from across the country, to help coordinate, identify those opportunities, and bring them up.
So let's see, we have about almost 10 minutes. I see Jen Lawson, I will answer your question at the end about the next learning series in terms of the future and the date and everything. I do see from Monica here, McMillan, thank you for your question. I'm interested in the community of practice you mentioned. I belong to a policy analyst COP in BC and would love the opportunity to join a Canadian one. Can you discuss this about this COP you're developing? Yes. So we are actually having an event on March 10th to co-develop what a policy hub like this would look like. We hope to have, we envision at least one person from every jurisdiction, one policy maker from every jurisdiction involved in this policy hub or policy community of practice. And we also hope there will be a patient rep from the patient council as well, of course. and we're still working on membership. But before we can do that, before we get buy-in from policymakers across the country, we have some ideas about what types of activities would be involved, but we want to co-develop these together. And this, so if you're interested, I can actually send you the Mara Steiner, who's our senior administrative coordinator, can send the invitation to you for you to register for the event on March 10th. It's from 1 to 2 p.m. Pacific, so I'm not sure. So you're in BC, so it'd be 1 to 2 p.m. You could, it's a hybrid event, or you could join in person if you registered for the CHASPR, Center of Health Services Policy Research. They have a conference that's occurring that week. So the CHASPR conference that has a policy focus. So you can register for that conference, or maybe you already are, or you can also join the event to co-develop how this policy hub will look, and what activities will be involved, what benefits will come out of it. So we do envision it to be very much a community of practice of policy folks across the country, but sometimes those words, community of practice, doesn't mean much to policy folks. Maybe it does. So we're kind of going back and forth between what we're going to call it. Hope that answers your question. But it's still in the works. In a nutshell, we have some co-development to do for that committee, that important committee for us.
Jamie, there's a question from Allison Soprovich about PREMS and PROMS work. And so Allison, maybe just to, I think we can put you in contact with the people who are leading the OECD Paris project and the CPIN initiative from Ottawa. But there is some work as well. So in different provinces, I think we haven't, there's work that's funded by Health Canada that's with the OECD that is collecting from multiple provinces. But within certain provinces, like in Ontario, they convened a bunch of people from this, members of the CPCRN to talk about all the work being done in the collection of patient-reported outcome and experience measures to try to come up with maybe a core data set. And that was actually, it was Ontario Health, the director of primary care and social determinants, that reached out to some folks from our network. And so I don't know if there's comparable efforts in Alberta, but there may be it's an interesting opportunity to connect, provide cross-provincial work with what each province or individual provinces are trying to do in this area. Jamie, maybe we can send some of the links to Allison to learn more about certainly what's going on within the CPCRN, and I'm happy to connect her with folks. And Jen Rayner would probably be the right contact for the work being done in Ontario.
Yes, and just to add on that, Allison, it also might be good to, again, there's the OECD Paris project that we mentioned. And so that's one project that we're validating a survey to collect PREM and PROM data. So there might be some intersections there as well. So yeah, it might be good. We can definitely help you connect with some people that are doing work on the pan-Canadian level. So I guess if there are no other questions, we have about 6 minutes. So we can, I just wanted to mention that we have a learning series monthly, the fourth Tuesday of every month from February until June. The next session will focus on a learning health system readiness tool that we hope to essentially implement in our practice-based research and learning networks in order to get baseline data about as to what their particular are they ready for this this learning health system work. And this will hopefully provide some recommendations back to them in terms of what areas they need to improve in, and et cetera. And this Dr. Sarah Ahmed from McGill University will be presenting this readiness tool. And there'll be an opportunity to ask questions about it, to provide feedback about clarifications. And we're still developing the session objectives in the flyer, but that we hope to have this promotion out shortly, within the beginning of March. But this session will be it's always the fourth Tuesday again of the month, from same time slot, noon, Eastern Standard Time.
All right, thank you all.